To achieve a perfect level of recovery, of course, recent nurses need to perform various kinds of treatment for the patient that we are treating, one of which is to provide drug therapy. One of the drugs that will be discussed this time is ketorolac. Let's see together.
What is ketorolac? Ketorolac is a non-steroidal anti-inflammatory drugs or NSAIDs that can reduce moderate to severe pain without many of side effects associated with opioids. This drug is often used after surgery or medical procedure that can cause pain. For the generic and the patent name, they are ketorolac, ketosic, farpain, Lecter, lactopain, lantipain, Lectorec, ratifol, rindopain, thoramine, torpain, remopain, skelto, thoracic, and toradol. For the medical preparation, there are tablet, injection, nasal spray, and ophthalmic solution. For the drug class and classification, ketorolac is a G-prescription drugs. Drug available to the public on prescription only, red dot. For the indication, treat post-operative pain, pain management in children, not for moderate to severe acute pain, treat musculoskeletal pain, cancer pain that has spread to the bone, migraine, and sickle cell anemia. Contraindication, people with side effect or allergy to NSAIDs. Intraoperative or preoperative administration, labor, patient with renal disease or failure, gastrointestinal problems, elderly patient.
Okay, then now we move to the side effects of using ketorolac. Using ketorolac can affect so many systems in our body. First, in central nervous system, can cause aseptic meningitis, cerebral hemorrhage, coma, CPA, dizziness, drowsiness, headache, psychosis, and seizure. Then in cardiovascular can cause edema or hypertension. Then in ear, eye, nose, and throat can affect laryngeal edema and stomatitis. Then in our endocrine system can cause hyperglycemia. Then in our gastrointestinal is abdominal pain, acute pancreatitis, bloating, constipation, diarrhea, diverticulitis, flatulence, GI bleeding, ulceration, and vomiting. Then in genitourinary can cause interstitial nephritis, renal failure, and urine retention. Then in hematology can cause adenomyocytosis, anemia, aplastic or hemolytic anemia, eosinophilia, leukopenia, and pancytopenia. Then in respiratory is bronchospasm, pneumonia, respiratory depression. Then in skin can cause leprosy, erythema multiforme, exfoliative dermatitis, photosensitivity, pruritus, and rash. Then the other is anaphylaxis, angioedema, hypokalemia, hyponatremia, injection site pain, lymphadenopathy, sepsis, and unusual weight gain. Ketorolac is related to its ability to inhibit cyclooxygenase 1 and 2 enzymes in the metabolism of arachidonic acid into prostaglandins and thromboxane 2. This makes ketorolac very effective in treating pain because the pathophysiology of pain involves prostaglandins. Ketorolac is non-constrictive in inhibiting COX-1 and COX-2 enzymes. COX-1 enzymes can be found in platelets, gastric mucosa, and vascular endothelium. Meanwhile, COX-2 enzymes stimulate and mediate inflammation, pain, and fever. The inhibitory effect of ketorolac on the risk of COX-1 enzymes can increase the cause of gastrointestinal bleeding and gastric ulcers. Inhibition of the COX-2 enzyme provides the desired therapeutic effects of ketorolac, namely as an anti-inflammatory and analgesic. COX-1 enzymes can be found in platelets, gastric mucosa, and vascular endothelium. The inhibitory effect of ketorolac on the risk of COX-1 enzymes can increase the cause of gastrointestinal bleeding and gastric ulcers. Meanwhile, COX-2 enzymes stimulate and mediate inflammation, pain, and fever. Inhibition of the COX-2 enzymes provides the desired therapeutic effects of ketorolac, namely as an anti-inflammatory and analgesic. Ketorolac can be administered intramuscularly, intranasally, and orally with varying bioavailability. Ketorolac is metabolized in the liver, cannot cross the blood-brain barrier, but can cross the placenta and is excreted in the breast milk or ASI and urine. Okay, now we're gonna talk about the first process of pharmacokinetic, that is absorption. In intramuscular, the absorption is rapid and completely absorbed. In oral, it is not completely absorbed and the bioavailability is attained to 100%. Also, food can affect absorption rate, but doesn't reduce the bioavailability. The bioavailability of intranasal ketorolac is 16%, and intranasal administration reaches maximum concentration after 45 minutes. Ketorolac takes effect within 13 to 16 minutes after ingestion, and the peak of analgesia is 1/2 to 4 hours. Okay, now the second process is distribution. The distribution doesn't cross the blood-brain barrier well, but it can pass through the placenta and breast milk. For intranasal formulation, most of ketorolac is stored in the nose and throat. Up to less than 20% accumulate in the esophagus and stomach, and less than 0.5% in the lungs. Okay, now it's about metabolism. The ketorolac is metabolized in the liver by hydroxylation and conjugation with glucuronic acid, and it divided into two stages. Then the half-life of ketorolac is 4 to 6 hours in adults and 3.8 to 6.1 hours in children. And the last process is excretion. The ketorolac is excreted by the kidneys, and up to 90% excreted in the urine, and 40% is secreted in the form of metabolites, and 16% in the form of ketorolac. A ketorolac excretion score of 6% was also detected in feces.
Okay, next is dosage and method of administration. The drugs can be given via oral, and the dosage is 10 milligrams. It can also be given via intravenous. The dosage is 15 milligrams per milliliter. It can also be given in 30 milligrams per milliliter. Next is via intramuscular. It can be given in 60 milligrams per 2 milliliters. And last is through nasal spray. For the adult dosing via intravenous and intramuscular, 30 milligrams single dose or 30 milligrams every 6 hours, not exceeding 120 milligrams in 24 hours. Next, via oral, 20 milligrams single dose after intravenous or intramuscular therapy, then 10 milligrams every 4 to 6 hours, and not exceeding 40 milligrams in 24 hours. Next is half-life, 5 to 6 hours for a single 30 milligrams intramuscular or single 10 milligrams oral dose. Pediatric dosing. For under 2 years old, it is not recommended, but for 2 until 16 years, for single dose, 0.5 milligrams per kilograms intravenous or intramuscular once, and not to exceed 15 milligrams. For multiple dose, 0.5 milligrams per kilograms intravenous or intramuscular every 6 hours, and not to exceed 5 days. Pediatric dosing for more than 16 years old and body weight less than 50 kilograms. Intravenous, it is 15 milligrams in a single dose or 15 milligrams every 6 hours. Do not exceed 60 milligrams per day. Via intramuscular, it is 30 milligrams in a single dose or 15 milligrams every 6 hours. Do not exceed 60 milligrams per day. Per oral, 10 milligrams once after intravenous or intramuscular therapy, then 10 milligrams every 6 hours. Do not exceed 40 milligrams per day. Okay, next is geriatric dosing. For single dose, intramuscular dosing, renally impaired and or less than 50 kilograms of body weight, one dose of 30 milligrams. Intravenous dosing for renally impaired is or less than 50 kilograms of body weight are one dose of 15 milligrams. For multiple dose, for patient with renal impairment and less than 50 kilograms of body weight, 15 milligrams ketorolac injection every 6 hours, and the maximum daily dose for senior adults should not exceed 60 milligrams. Next one is nursing consideration. The first one is myocardial infarction. Okay. Be aware that NSAIDs like ketorolac should be avoided in patients with a recent MI because risk of reinfarction increases with NSAID therapy. The next one is heart failure. Know that the risk of heart failure increases with ketorolac use because drug is NSAID. This class of drugs should not be used in patients with severe heart failure, but if unavoidable, monitor patient for worsening of heart failure. The next one is pain. Notify prescriber if pain relief is inadequate or if breakthrough pain occurs between doses because supplemental doses of an opioid analgesic may be required. Next is liver enzymes. Monitor liver enzymes as ordered if elevated levels persist or worsen. Notify prescriber and expect to stop drugs as ordered to prevent hepatic impairment. Next is history of peripheral edema, heart failure, and hypertension. Monitor patient with a history of peripheral edema, heart failure, or hypertension for adequate fluid balance because drug can promote fluid retention and worsen this condition. Assess patient for decreased activity tolerance, dyspnea, edema, and unexplained rapid weight gain. Notify prescriber if such symptoms develop. Next is history of GI bleeding or ulcer disease. Use ketorolac with extreme caution in patient with history of gastrointestinal bleeding or ulcer disease because NSAIDs like ketorolac increase risk of gastrointestinal bleeding and ulceration. Use ketorolac in this patient for shortest length of time possible. Next is decreased activity tolerance, dyspnea, edema, and unexplained rapid weight gain. Know that serious GI bleeding and ulceration and perforation of intestine or stomach can occur without warning or symptoms. Elderly patients are at greater risk. To minimize risk, give drug with food. If GI distress occur, withhold drug and notify prescriber immediately. Next is history of inflammatory bowel disease. Monitor patient with history of inflammatory bowel disease such as Crohn's disease or ulcerative colitis because ketorolac may worsen this condition. Next one is hypertension. Use ketorolac cautiously in patient with hypertension and monitor blood pressure closely throughout therapy because drug can lead to onset of hypertension or even worsen the existing hypertension. Thrombotic events. Monitor patient closely for thrombotic events including myocardial infarct and stroke because NSAIDs such as ketorolac increase this kind of risk. These events may occur early in treatment and risk increase with duration of use. Be aware that these events have occurred even in patients who do not have a history or risk factors for cardiovascular disease. Chest pain, slurring of speech, shortness of breath, and weakness. Monitor patient for warning signs such as chest pain, slurring of speech, shortness of breath, or weakness. If any signs and symptoms develop, withhold ketorolac, alert prescriber immediately, and provide supportive care as prescribed. Okay, next one is monitor patient, especially if elderly for less common but serious adverse gastrointestinal reaction, including anorexia, constipation, diverticulitis, dysphagia, esophagitis, gastritis, gastroenteritis, gastroesophageal, reflux disease, hemorrhoid, hiatal hernia, melena, stomatitis, and vomiting. Also, monitor bone and serum creatinine levels in the elderly patient with heart failure, hepatic impairment, or impaired renal, and those who are taking ACE inhibitors or diuretics because drug may cause renal failure. Monitor complete blood cell for decreased hemoglobin and hematocrit because drug may worsen anemia. Next one is patient who has bone marrow suppression or is receiving antineoplastic drug therapy. Know that in patient who has bone marrow suppression or is receiving antineoplastic drug therapy, monitor laboratory result including white blood cell and assess for evidence of infection because ketorolac has anti-inflammatory and antipyretic actions that may mask signs and symptoms such as fever and pain. Okay, for the last one is rash or other evidence hypersensitivity reaction. Assess patients' skin routinely for rash or other evidence of hypersensitivity reaction because ketorolac is an NSAID and may cause serious skin reaction without warning. Even in patients with no history of NSAID hypersensitivity, stop drugs at first signs of reaction and notify prescriber.
Childbearing consideration. Pregnancy increased risk of premature closure of the fetal ductus, enterios, and fetal renal dysfunction. Avoid a gestational age above 20 weeks. Pregnancy category C. Labor and delivery affect fetal circulation and inhibit uterine contraction. Contradicted during labor and delivery. Lactation. Drug is present breast milk. Patients should check prescriber before breastfeeding. Reproduction. Affect fertility by delaying or preventing rupture of ovarian follicles. Should not be given in women who are planning to conceive or who are difficulty conceiving. Special precaution. Decrease dose by 50% in patient with renal failure and in elderly patient. And do not use more than 5 days. And here are for the references.
So here's the end of our video. We are from Small Group 3 IT. I am Meidy and my friends Sandi and Kevin. We thank you for watching our video to the end. Hopefully this video can be a blessing for you.